We are seeking to build the evidence base around child protection and family welfare in global settings. We are housed, the Secretariat of the CPC Learning Network is housed here at the Mailman School of Public Health. And we work in partnership and through networks with academics, practitioners, and policymakers throughout the world. And we are delighted to be co-hosting this symposium today with the Global Social Service Workforce Alliance, whose coordinator, Amy Bess, is with us as well. She'll speak in just a few minutes about what they do there. We have an all-star lineup of people to talk to you today. When Amy and I first brainstormed this symposium a few months ago, we brainstormed a list of people who might be able to talk to us about strengthening the social service workforce in settings around the world, both in the United States and internationally. And the people that we brainstormed are all here before us. We were really pleased that everybody was able to join us. Thanks to those of you who are joining us from out of town. We appreciate your time. The question that we're looking at today is, what are the efforts to strengthen those people who work in the social service workforce? What do we do to try to strengthen their skills and capacities? And how do we measure our efforts to strengthen the social service workforce? How do we measure success? What does it mean for us to have strengthened the workforce capacity of people who are working with children, families, other vulnerable populations? When I mention the word measurement, it's a bit of a click in my brain. You know, that is what we do at the CPC Learning Network, is try to measure the effectiveness of policies and practices. But when you're looking at something like workforce strengthening, it's not always as straightforward. We don't always have these clear quantitative indicators that tell us that something is working or not. So we're going to be hearing about a lot of creative different approaches to measuring social service workforce strengthening today. So open your mind to the many possibilities of measurement. In terms of housekeeping, I'm not sure where the restrooms are located.
Straight and to the right.
Straight and to the right. For those of you who are presenting and might have reimbursement or transportation issues, I hope you've already met Eva. She's just popped out for a second, but Eva Noble is the person to see. In terms of the way that this symposium is situated, I would also add that this is the second of a three-part series that we are organizing over the course of this academic year. The first was held in October, and it was about measurement of violence against children. And for that, we had professors from Columbia and other universities who are interested in measuring the various forms of violence that children face, as well as from the Centers for Disease Control and Prevention, which is organizing a number of national violence against children surveys around the world. Today you'll hear, I hope you've all seen programs which are located around the tables. If not, then you can find them on the resource table. This symposium obviously is about measuring social service workforce development. And later in the year, with the Better Care Network, we'll be hosting a symposium on care and issues of care and how do we take care of children and how do we measure that. So the Better Care Network is here. This is Florence Martin, for those of you who would like to get to know her a bit today. So without further ado, we are in the mobile era, and I will be reading a bio from my cell phone. It arrived at 7:30 this morning. Sorry, I wasn't supposed to do that. Sorry. Amy Bess is the coordinator of the Global Social Service Workforce Alliance.
7:30, Amy? Wait a minute.
A group that aims to generate the knowledge and evidence, resources and tools, and political will and action to address key social service workforce challenges in low and middle income countries. She provides administrative, technical, and strategic support to the Alliance to achieve its mission, strategy, annual goals, and objectives. She has 20 years of program and management experience with international nonprofit organizations. She has designed, managed, and evaluated emergency response and community development programs for vulnerable children in Africa, Asia, and the Balkans, focusing on psychosocial well-being and protection of children and youth. She has also managed US-based refugee resettlement programs. She has a Master's of Social Work in Community Organization and Administration from the University of Michigan. And with that, it's over to you, Amy. Thank you.
Well, welcome everyone. We're happy that everyone can be here today in the midst of all of the snow days and holidays and everything, that we could still make it here today. And luckily we have beautiful weather. So, well, as Mark was saying, we both coordinate networks, and the purpose of those networks are to convene people for discussions about some of the key topics and issues that our networks cover. And there is a crossover in our networks in terms of focusing on the well-being of children. And the Alliance zeroes in to focus on the workforce and the people who carry out this work. And so today is really looking at how we can be sure that we're creating the context to create the best working environments to allow the people who do this work to do it in the best way possible and to deliver the highest quality services to children and youth. And so whether that's bringing together the research that's available and has been conducted and identifying what works and building that into training and development of the workforce, or and also understanding how to measure the progress of workforce strengthening programs. So we're looking forward to today's conversation, and we have a lot of great set of panelists or panels and speakers today.